speak on the topic epigenetics in cardiovascular disease. Sairam.
Good afternoon, one and all. Om Shri Sai Ram. Humble pranams at Swami's divine lotus feet. Sitting amongst all of us right now is Ayer sir. He has done most of my job already. I'm not sure how qualified I am to speak on this topic of epigenetics. Perhaps my only qualification comes from the fact that I've heard this word epigenetics 2 decades ago when Dr. Krishna Rao was taking a class when we were in first year cardiology. We have these classes between Puttaparthi and Bangalore, and they go on till now. So in one of the classes, I told my senior, genetics tak to suna tha, ye epigenetics kya hota hai? And then he said, suno. But then to now, I think um, I'm still grappling with the impact of epigenetics. I think one of the other reasons I might be here talking this topic is for me to get present as to how much all of us would get benefit if we actually adopt the healthy lifestyle and how we can actually make long lasting changes in our own lives. So, the promise 80% of cardiovascular disease is preventable. The premise, I think we've been hearing it all along the last 2 days. And Iyer sir has made my work very easy because he's spoken most of my slides. Uh, I think it was, we're always speaking about the same things. So we have to be more active, quit tobacco, get healthy sleep, eat better, manage our weight, blood sugar, blood pressure, and cholesterol. The question is, what is epigenetics? So we are all born hardwired with a specific set of genes, our DNA sequences, etc. But the environment which we give our genes is what allows them to manifest either with disease or with health. So the uh, the phenotypical expression of the genes is what we are talking about. And it's true because we all know that, twins are born with the same genes, but if we give different environments, if one is a smoker, one is not, one is eating healthy, one is not, we will have different outcomes. So it's not really our genes, but the environment we provide our genes, which probably are going to have the final expression and the final outcomes based on that. The study of heritable changes in gene expression that are not due to changes in DNA sequence. And there are many epigenetic mechanisms and pathways, and they're commonly involved in all our day to day disease problems which we encounter as cardiologists. Right now, yesterday, we had a whole talk on inflammation. So, again, it's one of the epigenetic pathways which works on inflammation, vascular dysfunction, leading to atherosclerosis, heart failure, diabetes. Because most of the times we always think that diabetes has come from, only our food or something like that. But people ask for evidence, and the evidence comes from epigenetics. Almost everything that Iyer sir spoke on, the pathways, the signaling pathways, the metabolic pathways are all finally our epigenetic pathways. Again, we have histone modification. All of these impact and lead to heart failure, diabetes, high blood pressures, LV hypertrophy. And we've all been talking a lot on Mirnas recently. So again, this impacts the heart directly, causing arrhythmias, myocardial infarction, LVH, etc. With cardiovascular disease, the mechanisms are many, not going into the details again, but this is a slide which was published in 2010. Okay, so right now we have n number of all these Mirnas available with us. And I think IHL as such is doing a lot of work on Mirnas, and I think there's a lot of scope for more research in epigenetics. So they lead to cardiomyopathies, lead to cardiomyopathy in heart failure, DCM, and so many pathogenic pathways are there. Finally, it all boils down to only this, that yes, on the positive side, we have a few things, but on the negative side, we've already spoken about all this pollution, family history, toxins, our dietary patterns and habits, alcohol, smoking. Infection was recently spoken about, as Sir called it, syndemics, and exercise, medications, and a proper diet and nutrition will actually be positively influencing our genes. And pollution at every level, be it air pollution, noise pollution, climate changes, chemical pollution, has all known and proven to be uh, causing heart disease, vascular disease, strokes, hypertension, atherosclerosis, coronary artery disease, and of course, metabolically also obesity, etc. And all this is the biological, biochemical pathways can be explained through not providing the gene a healthy environment. Again, stress is a risk factor. We all know that acute stress can lead to a myocardial infarction, but chronic stress also, which could be in the form of a psychological stressor, would have, you know, can cause a lot of impact and lead to epigenetic modifications. But though, do we have hope? Is there any solution? And again, the answer is yes. Uh, Actually, much more in detail has already been spoken about. I just speak about a few things here. For example, a simple component like curcumin, which reduces inflammation. I think we spoke about this even yesterday. There is data to show that curcumin can reduce inflammation. It even impacts the cholesterol, reduces platelet aggregation, decreases triglycerides, reduces the cytokines, etc. The question is how much, in what form, and those answers I think are still to be explored. We all know that turmeric has been incorporated in our diets, but the colors that are used today may not really be turmeric always. So it's always better to have go back to our roots, go back to our parental or grandparental time where food was prepared differently, and it leads to reduction in oxidative stress, improves the nitric oxide availability. Again, we have vitamin C. All of us, I think in the COVID time, there was a resurgence of people using vitamin C, and it favorably reprograms the epigenome. It has also been shown to reduce atherosclerosis. Although we don't talk about it too much to our patients, we say statins cause plaque regression, but even simple things like vitamin C can do the same. Uh, Exercise again has got very strong cardioprotective epigenetic benefits. Then the sleep epigenetics, Sir has already mentioned about a good quality deep sleep. So sleep deprivation, poor quality sleep will also lead to target gene expression changes and lead to stress. Sunlight exposure, we hardly get any of it being cardiologists. And again, mindfulness and meditation, pranayama, and all of this. So, epigenetic therapeutics is already in place with so many drugs like we have statin, aspirin, etc. And these are very favorably helping the patients. Moving towards precision epigenetics, I think the future will talk about it. And there are a lot of challenges that, when we exercise for 3 months and then leave it off, then what happens? Certain changes, actually, we go back to, you know, uh, being the old way sometimes. Sometimes we adopt a new lifestyle changes made in terms of food, and then we stop it after 3 to 6 months for whatever reason. And then again, the epigenetics takes over. So we could simply follow what Swami's spoken about the food, heart, and mind. And Swami has said that it is the primary responsibility of every individual to prevent becoming a victim of heart disease by regulating his food and other habits, and prevention being better than cure. And there's little room for cardiac ailments if one's food habits are properly controlled and regulated. Swami has asked us to focus on spiritual heart, the vitamins. Swami said that if the vegetarian food that is consumed should be balanced and wholesome. It should contain liberal doses of vitamin C and vitamin E, which are available in vegetables like carrots. The presence of these vitamins prevents heart ailments to a large extent. So I think morning also we were carrying placards saying the same. Swami also said to avoid fried food. Swami said that birds and beasts do not suffer from cardiac and digestive ailments to which man is prone. The cause can be traced to the natural food which the animals consume, unlike human beings who consume all sorts of fried and cooked items of food, being slaves to the palate. Since Swami told us to eat the right type of food, avoid fatty food substances, leafy greens, and reduce worry, hari, kari. Swami said that man today is a victim of worry. What is the cause of this worry? Lack of contentment is the cause. The rich man is not contented in spite of the accumulation of wealth. So worry causes hurry, and both together bring about ill health. The theme of today's conference, actually, all this has already been covered in the last 2 days. So these are our do's and don'ts, and I would end with a prayer to Swami that Swami blesses us all as cardiologists, as doctors, as his uh, chosen doctors, that we all take care of our own health as much as we advise the patients. Sairam, thank you.